All right, today we're jumping into a medical case that, honestly, it reads more like a detective story. We're talking about a silent trap, a situation where some really mild symptoms are actually hiding a massive medical emergency.
So here's the big question, right? How can some vague belly pain actually be hiding a life-threatening catastrophe? I mean, this is a real puzzle that doctors deal with. It's like the body's alarm system just shuts off, and that's when the clock really starts ticking.
And for one 58-year-old patient, it did. His story is the perfect example of this danger. So let's dive in and uncover this silent trap. By the end of this, you're going to see exactly how this trap gets sprung, and crucially, how doctors figure out how to disarm it. Okay, section 1. Let's talk about the setup, the initial presentation, and those dangerously misleading symptoms that create the trap in the first place. So, get this. Our patient is a 58-year-old man with diabetes. He comes in saying he's had this kind of vague abdominal pain for 3 days. Nothing crazy, just a mild fever to go with it. But here's the thing that's so important. There are none of the classic severe symptoms. No abdominal guarding, where the muscles get super tight. And then, out of nowhere, he collapses. His blood pressure just bottoms out. The question is, how on earth do you go from a little stomach ache to a total collapse? Which leads us right to the heart of the mystery. Why didn't the alarms go off? Why did the body's warning system completely fail here? Okay, this comparison here is just wow. It shows the problem perfectly. Look at a typical patient with this issue, a perforated ulcer. The signs are loud and clear. Sudden, terrible pain, a stomach that's hard as a board. You can't miss it. But then you look at our patient, the diabetic patient. What do you see? Vague discomfort. Guarding may be absent. The body is basically whispering when it should be screaming, and that makes a diagnosis so difficult. So why the silence? Well, it turns out that long-term diabetes can lead to something called autonomic neuropathy. The best way to think about it is like faulty wiring for the body's alarm system. The pain signals just aren't getting through properly. And that's not all. The immune response is weaker, and those chemical messengers that are supposed to yell, "Hey, there's inflammation over here," they're all muffled. So the key thing to get here is that the body isn't ignoring the problem. It literally can't shout about it. All right, so this brings us to a really crucial part of the story. Because while the symptoms were quiet, the disease was not. There was a ticking clock. This timeline really lays out the hidden danger. At hour 0, boom, the ulcer perforates. Stomach acid and enzymes just spill out. But for the next 24 hours or so, the contamination is totally silent. Bacteria are just multiplying, growing. And because the body's alarm system is busted, the patient just feels a little off. But then you hit that critical window, 24 to 72 hours. That's when the bacterial toxins hit a tipping point. They completely overwhelm the system, and that leads to that sudden catastrophic collapse we talked about. And this right here, this is probably the single most important idea to take away from this whole thing. The collapse looked sudden, but it wasn't. The disaster underneath had been building silently for days. So what is this end-stage catastrophe? It's called septic shock. And basically, it's when the infection gets so out of control that the body's own attempt to fight it backfires. The immune response starts attacking its own tissues and organs. Blood pressure tanks. Organs start to fail. It's the final, deadly reveal after that silent progression. Okay, so now for the detective work. How do you unmask the culprit when it's hiding so well? Let's look at how the clinicians figured this out. So, clue number 1, tachycardia. This is just a fancy word for a fast heart rate. What's amazing is that even when the patient says the pain is mild, even when their blood pressure looks okay, the heart starts beating faster. It's trying to compensate for the infection and the fluid loss that's happening inside. It is often the very first subtle whisper that something is seriously wrong. And then you get to clue number 2, and this is the smoking gun. You see, when there's a hole in the GI tract, air escapes. And where does that air go? It rises to the highest point in the abdomen, right under the diaphragm. When you see that on an X-ray, that is the classic, undeniable sign you've got a perforation. All right, clue number 3 is just a number from a lab test, a lactate level over 2. So what does that actually mean? It means something's really wrong. A high lactate level is a huge red flag. It tells you that the body's tissues aren't getting enough oxygen, probably because of shock. So the cells are forced to switch to this emergency backup power mode, one that doesn't need oxygen. And lactate is the waste product of that process. Seeing that number climb tells you the body is under incredible stress, even if the patient on the outside doesn't look all that sick. Yet. Okay, let's bring it all home. Our final section is about what happens next, how this emergency is managed, and the big takeaways from all of this.
So once the diagnosis is finally made, it is an absolute race against time. The response is fast and follows a very clear plan. Step 1, resuscitate. That means stabilizing the patient, getting IV fluids in, supporting their breathing. Step 2, hit the infection hard with powerful, broad-spectrum antibiotics right away. And step 3, get to the operating room to physically plug that hole. And the surgery itself is actually pretty ingenious. The go-to technique is called a Graham's patch. The surgeon takes a piece of something called the omentum. It's this fatty layer of tissue inside the abdomen, and they use it as a kind of living biological plug to seal the hole. Pretty cool, right? You know, there's a quote from the source material that just sums this whole thing up perfectly. It says, "These patients lie clinically." What that means is their physical exam, what you see on the outside, just doesn't match the absolute catastrophe happening on the inside. It's such a powerful reminder to always, always look deeper.
And hey, this isn't just a lesson about diabetes. The elderly, anyone who's immunocompromised, patients on long-term steroids, they're all at risk for these same kinds of silent traps. For all these groups, you have to have a really high index of suspicion because you just can't count on their bodies to give you that classic textbook reaction to a crisis.
So I think the big lesson here is pretty clear. We have to learn to spot when the usual signs just aren't there and really hunt for those subtle clues instead. This whole case is a powerful lesson in looking past the surface. And it kind of leaves us with a final question, doesn't it? What other silent traps, not just in medicine, but in life, are out there, just waiting to be found if only we learn to look beyond the obvious?